So good morning or good afternoon to everyone, depending where you are joining us from. We still have a few people logging in, so if you want to let us know where you are logging in from, you can go to the chat box and just write where you're logging in from and maybe who you are in one sentence. So just go to the chat box at the bottom. We're going to start in about 2 minutes from now. So I see we have a very diverse audience today. So we're going to start in 2 minutes from now. So I think we are good to go. I'm sure still a few people will join us in a few minutes from now, but let's start because we have a very interesting but packed program for the next 90 minutes. So welcome to presenting the Dashboard 2019, 10 Years to Elimination. My name is Joost Wagner. I'm going to be your moderator. So thank you very much for joining us for the Dashboard launch today. And I would like to give a few housekeeping remarks before I share the objectives of today and then hand over to our chairs for today. May I request the Secretariat? Yes. So audio and video is of course disabled for all attendees, but we highly encourage you to use the chat box, and I appreciate everybody sharing who you are and where you are calling in from. We remind you that the launch will be recorded and shared on social media. And we would like to inform you that there is no live Q&A session, but we appreciate if you use the chat box very much if you have any comments you want to raise and during the presentations or after the presentations. And we also encourage comments and questions at dashboard@aplma.org. And we also have an opinion poll for you during this session. So these are the quick housekeeping remarks. And today, as I already mentioned, it's the launch of the APLMA Leaders Dashboard 2019. We will hear more about that in a very short while. We're going to highlight the progress made towards elimination in Asia Pacific along 8 milestones of the APLMA Leaders Dashboard 2019. And we have a couple of speakers who are sharing bits and pieces of success stories. And then we are going to finish with a call to action for staying on the course to elimination. So this is our program for today. And usually the dashboard would be shared during Malaria Week, but the current travel restrictions unfortunately don't allow us to meet face to face. So we have to do it in a different manner. So if you have any comments or if you have any suggestions, please send it to the email I just mentioned at dashboard@aplma.org, and it will be in the chat box from time to time. And I will come back to that again. And now I have the honor to hand to our 2 chairs, 2 very experienced and senior public health experts. Our chair for today is Ibu Siti Nadia Tamizi. She has led various national disease control programs such as TB, malaria and HIV in Indonesia for over 15 years. And Dr. Nadia is the Director of Vector-Borne and Zoonotic Disease Control and Prevention at the Ministry of Health in Indonesia. Selamat sore, Ibu. And our co-chair today is the new CEO of APLMA, Dr. Satak Das. He joined only 10 weeks ago, so I understand he's still forced to work from Boston, while the APLMA Secretariat he's the CEO for is in Singapore. So we really appreciate Dr. Satak to join us at this late hour. I understand it's 1 o'clock in the morning. But now I have the pleasure to hand over to our chair, Ibu Nadia. Over to you, madam.
Thank you, George. Ladies and gentlemen, I warmly welcome all panelists and all our distinguished guests to the launch of the 2019 APLMA Leaders Dashboard. At 2015 East Asia Summit, the region committed to the goal of an Asia-Pacific free of malaria by 2030, endorsing the APLMA roadmap as a framework to achieve it. The dashboard tracks the progress made against the roadmap priorities and highlights key policy challenges that country needs to focus on to achieve elimination. While country differs in the details of the implementation, we all share the common goal of a malaria-free Asia-Pacific region by 2030, a mere decade from now. We welcome the opportunity to share experiences and information through this platform, which represent a great opportunity for us to learn from each other to accelerate progress toward our common goals. We look forward to hearing from our representative today. So I would like to hand it over to Dr. Sartak as my co-chair, please.
Thank you, Dr. Siti, and thank you all for joining today. It is a real honor to be welcomed into the malaria community, and I'm quite familiar with the region, but in other infectious diseases largely, although I am certainly familiar with working on infectious diseases at the community level, as well as at the national level and at the regional level. And in the with regards to the dashboard, I think I wanted to say one thing first and foremost, and that as I get to know the malaria community, and as I even sit here today in this event, it is remarkable to see what the malaria community can offer the world at this particular time as we struggle with the pandemic in various ways. I think where I sit now could certainly learn a lot about what collaboration means across borders. Perhaps that's across state borders in this case, as opposed to international or national borders. But it's a remarkable thing, the way that this region is working together and has understood it to be a regional problem and knows that the only pathway to elimination is to work across borders and to share that information. So this is in practice, in real time, a living example of what true global health practice is. And I thank you for allowing me to be part of that. The dashboard, as most of you probably know, is really in two parts. One is a technical annex, which largely relies upon data from the World Health Organization and from the Global Fund. Also, as many of you know, these data are from 2018, although we're calling it a 2019 dashboard. And in fact, just this week and just about an hour ago, we were having a conversation with our colleagues in Cambodia about how we might be able to, in the future, find other ways to present alternative versions of the dashboard, which could reflect the kind of data that is available even up as current as July in areas such as in the GMS. And so while acknowledging that these data are from 2018, at the same time it takes us to the second dashboard, and that is the Leaders Dashboard, which we're here to discuss today, which outlines policy milestones across the 22 endemic countries in our region. I'd also just like to note before we continue to the speakers that at the 14th EAS in November 2019, the leaders made a request for a 5-year progress report towards the 2030 goal of elimination, and that report is currently circulating among many of your governments and among many partners. The last quick things I wanted to say is first that there has been tremendous progress made, as we'll hear more about. That is in terms of making malaria a notifiable disease in some countries, in increases in domestic financing. But at the same time, we are seeing that there remain considerable challenges towards elimination. A major one is that the success can, in a way, become part of the problem in that malaria becomes more invisible. But we want to ensure, as a secretariat and in working across our countries, that the voices of the vulnerable, those who are in remote areas, those who continue to be the persistent pockets where malaria persists, have their voices elevated and ensure that the data, both in terms of malaria, the disease itself, as well as best practice, continues to be shared to help share a robust series of interventions for those groups in particular. I think there are also issues that still persist around resistance, around radical cure for Vivex, around outdoor biting, and I think probably would be completely remiss if we didn't acknowledge, and something that we'll be talking about later on as well, the challenges that may be posed for malaria programs across the region, and also the opportunities by the current pandemic that is COVID-19. So with that, I turn it back to you, our moderator.
Thank you very much, Ibu Nadia and Dr. Das. I just wanted to remind everybody who's writing in the chat, there are two possibilities: writing to all panelists, so all the people you see here in the moment on the video screen, or you can write to all panelists and attendees. So if you do write your remarks or comments or where you're from, please write to all of us, including all attendees, so we know that you are there. Thank you very much for these opening remarks. And before I introduce our country speakers, Dr. Das has mentioned, please grant us a few minutes for a short video summary which highlights the progress of Asia Pacific towards malaria elimination. So a 5-minute maximum video.
In Asia Pacific, malaria is being defeated. Since 2016, leaders in Asia Pacific have used the APLMA Leaders Dashboard to track progress towards policy reforms in 22 countries in support of eliminating malaria by 2030. The Leaders Dashboard is a mechanism to keep track of the region's progress towards elimination. It was developed and refined in close collaboration with countries and key stakeholders. The dashboard tracks progress towards elimination across 6 priorities of the Asia-Pacific Leaders Malaria Alliance Malaria Elimination Roadmap. 1. Unite national efforts and regional actions. 2. Map, prevent, test, and treat the disease everywhere. 3. Ensure high-quality malaria services, tests, medicines, nets, and insecticides. 4. Improve targeting and efficiency to maximize impact. 5. Mobilize domestic financing and leverage external support. 6. Innovate for elimination. Since 2016, countries have demonstrated remarkable progress. In 2016, Sri Lanka was certified malaria-free. China reported no indigenous cases since 2017, and since 2018, there have been no cases reported in Malaysia and Timor-Leste. 8 other countries in Asia-Pacific now have fewer than 10,000 indigenous cases. tripled domestic financing compared to the 2012 to 2014 period. In 2 years, we have seen 20 new greens for 13 countries across the different policy milestones. Building on this momentum, the 2019 Leaders Dashboard demonstrates a story of optimism. Here are 5 key takeaways from this year's results. The progress towards malaria elimination continues. Out of the 22 tracked malaria endemic countries in the Asia-Pacific region, 12 countries have a national task force for malaria elimination in place. 20 countries have a costed malaria elimination plan in place. 13 countries have a legislation in place to make malaria a notifiable disease. 15 countries have a system in place to report cases from all providers. We're building a strong foundation for the future. As more countries become on track on policy indicators, we see downward curve for malaria cases and deaths. Plasmodium falciparum malaria is declining rapidly in the GMS. New treatments and diagnostics are in pipeline to accelerate cure for Plasmodium vivax malaria. We note a steady increase in domestic financing, leading to better resource mobilization. By collaborating across ministries, countries are able to tackle health priorities more effectively. We still face last-mile challenges to elimination. Anti-malaria drug resistance and insecticide resistance continue to threaten progress. Burden of relapsing P. vivax malaria continues to rise. Lack of real-time data reporting and sharing across borders. Focusing on key strategies is critical. These indicators also serve as cornerstones required to effectively address existing threats like malaria and emerging new ones such as COVID-19. Every country is contributing to the larger regional fight. Through strong national commitment and effective collaboration from a wide range of actors, Asia-Pacific is positioned to deliver on the promise of a malaria-free Asia-Pacific by 2030. 2020 signals our last decade to defeat malaria. We need to stay the course. Asia-Pacific is at the forefront of a global movement to eliminate malaria. The last 5 years have shown us what we can achieve when we work together. Amidst COVID-19, let us use this opportunity to protect ourselves from both malaria and emerging health threats. With bold leadership, vision, and adequate financing, countries can address drug resistance and build strong health systems. Let us be the generation to end malaria for good.
Thank you very much for sharing this video. I think this was very illustrative. And now is actually time for sharing 4 lessons of success. And we will hear from our colleagues from China, Vietnam, Cambodia, and Vanuatu on progress made and initiatives taken to further the fight against malaria. So we are glad to have very experienced speakers with us today. Unfortunately, time is of the essence, and they will have only 5 minutes each to share their lesson. However, we have the APLMA Secretariat supporting us with some relevant links whenever appropriate. So keep an eye on the chat. Also, we would like to request all participants, if you have any comments or you want to raise an issue, you can write in the chat. We follow that one. And last but not least, as I said at the beginning of our event, we would like to hear your feedback on the dashboard, and any points you want to raise, you can contact APLMA at dashboard@applma.org. to raise your questions or comments about the dashboard. So, without further ado, our first speaker is Professor Zhou. He is the director of the National Institute of Parasitic Diseases of the China CDC since 2010. The center is also known as the Chinese Center for Tropical Disease Research and a WHO collaboration center and a very unique institute, as it is also in charge of the National Control Program for Malaria. And Professor Zhou brings actually 40 years of experience to the table. Professor Zhou, congratulations on reporting 0 malaria cases for the last 3 years. So can you elaborate in the next 5 minutes on how making malaria a notifiable disease has played a role in elimination efforts? So over to you, sir. I can't hear you, Professor Zhou. Professor Zhou? So I think Professor Zhou has a problem with the sound in the moment. Shall we then go first to Vietnam, and in the meantime we check then that we solve the tech problem?
Hello, can you hear me now?
Yes, sir. Please go ahead.
Okay, thank you. Good morning and good afternoon, ladies and gentlemen. Thanks for the moderator to
So there's still a sound problem. Professor Zhou, can you switch off your webcam for a moment? I think while you show the slide, it might be a better connection. So please start again. So there seems to be a serious problem with the bandwidth. So I would suggest that we go on then to the next presenter. And in the meantime, we figure out if we can log in with a different web. Okay, so let's move to Vietnam. So our next speaker would be Dr. Tang. He's the head of the epidemiology department at the NIMPE, the National Institute of Malariology, Parasitology and Entomology at the Ministry of Health at the Socialist Republic of Vietnam. And I would like to ask Dr. Tang I heard about Vietnam has recently established a financing sustainability plan to ensure sustainability to 2030 and beyond. Can you tell us a little bit more about that plan and the process for establishing it? Over to you, Dr. Tang.
Thank you, George. Yeah, good afternoon, and thank you, APLMA, to invite us for participating this meeting. I think this very cost-effective meeting, thanks to COVID-19. So we have very effective meeting in terms of the cost. So I would like to present the financing sustainability plan for malaria in Vietnam. So here you can see the figure with the domestic fund. We see in it increase year by year with the zero line. And then for the dark line with the external support. So for the last 3 years, we got 31 million US dollar from Global Fund. And also in the same Vietnam commit 18 million US$ for eliminating malaria. Yeah, it's also very important to have continued external and domestic resources to support our regional target for malaria elimination. Especially, we approach the transition from global fund financing. That is why a financing sustainability plan is important. A financing sustainability plan is to ensure the increased government contribution. This plan also to ensure sustainability of the program in the long term. It should support the integration of malaria within wider health system. And Vietnam recently set up financing sustainability plan. We took the following step to set up this plan. First, Vietnam show a strong government commitment. The government issued resolution number 20 in 2017. The government commit to continue invest around 20 million US$ per year for malaria control and elimination in malaria control activity, infrastructure, and also the other resources. We also organize different meetings and workshops to mobilize the resources with the participants from a representative of ministries, different stakeholder, sector, union, partner, donor, and also the international organizations such as WHO, CHI, IOM, etc. And the third thing here we would like to mention, Vietnam also developed a plan for malaria control and elimination in the period in 5 years, 2021 to 2025, with the vision to 2030, and we submit to Ministry of Health, and this already approval last month. And we also mobilize the local government commitment. We send the official letter to provinces, request co-financing commitment from provincial pupil committee. And the third I would like to mention here, in Vietnam recently, we reform the health organization system by merging the preventive medicine system to CDC in order to focus resources for malaria control and elimination. So with this system, it's worked very cost effectively and also efficient. And recently, you also know that in Vietnam, we have very successful story for control, for fighting COVID-19. So with this system, it worked very efficiently. So this is an experience from Vietnam I would like to share with you, and we also would like very much to learn the lesson from different countries, from international organizations. And thank you very much for your attention. Thank you.
Thank you very much, Dr. Tang, and for sharing key elements of financing the financing sustainability plan of Vietnam. Very interesting, and I hope we will be able to visit Vietnam soon. And we all know that Malaria Week is scheduled in Vietnam. Maybe it's only virtually this year, but hopefully we can travel and have this interaction with you on the lessons learned. So let me go back to Professor Joe. Professor Joe,
yes.
had some problems with the sound, but he logged in and out, and he should be good to go. So, Professor Joe, we were just talking about how making malaria a notifiable disease has played a role in elimination efforts.
Yes.
Over to you.
Yes, thank you. Thank you, Just. Good morning or good afternoon, ladies and gentlemen. Now I would like to introduce what happened in China. Probably you can see from the map of China. So China has launched the National Malaria Elimination Program since the year 2010. So the first map in the right side, you can see, so at that time, we have a lot of red dots. More than 71 counties, they have the red dots, which highly transmitted the area. And together with the yellow color, also very highly endemic for the malaria. But since we launched the elimination program, and the number of the cases, the indigenous cases, reduced significantly due to we intensify our surveillance and response system. So you can see until the year 2013, so all the indigenous cases are mainly located in the border area. And until the year 2017, 0 indigenous malaria cases was reported. So since the year 2017, so 0 indigenous cases already being reported in China up to now. So we hope with our evaluation process, by the end of this year, China will be announced free of the malaria. So as you see, our surveillance and response system is majorly contributed by the law of the prevention and control of infectious disease, which launched in the early 1980s. So in this first law on the prevention and control of infectious disease, malaria as listed one of notifiable infectious disease. So in this notifiable infectious disease list, there are two infectious diseases listed as a catalog A, and 26 infectious diseases was categorized as the B catalog line. And the 11 infectious diseases was listed in the catalog C. But malaria actually listed as one of catalog B infectious disease, which means during the 24 hours, all the cases in this catalog B should be reported to the national level. So malaria is one of catalog B, also should be reported to national level during the 24 hours. But what the launch the elimination program, we actually intensify this system into the 137 approach. One means all the malaria cases will be reported within the 24 hours, which means 1 day. And a case investigation will be conducted within 3 days to identify whether the case is indigenous case or imported case. And if for the indigenous cases, so all the response should be carried out immediately. So the focal cost by the indigenous cases is considered as the active focus with the response activities such as IRS and RACD. That will be done within 7 days. So this 137 approach should be implemented at a county level, and all the professional staff from county CDC in charge of all these activities. With these activities, and we can stop the transmission, local transmission of the malaria So we really can move forward of this program. And compare with the WHO catalog after the WHO proposed the 3T: test, treat, and track. The China's contribution is not only using 3T strategy, also put the timeline. This is
So I think we lost Dr. Joe again. So I don't see any movement. Okay, I'm afraid we have to stop here, and maybe we can come back to Professor Joe in the follow-up question we have for him. So our next country is actually Cambodia, and I have the pleasure to introduce you to Dr. Huy Ricol, who's the Director of National Center for Parasitology, Entomology, and Malaria Control in Cambodia, also known as CNM. Dr. Ricol has held the position of Director of CNM since 2014 onwards, and his career in public health spans over 24 years. So, Dr. Ricol, congratulations to Cambodia on establishing both national and provincial task forces. So what role will task forces play in leading Cambodia to its elimination goal? Over to you, Dr. Ricol.
Thank you. Can you hear me?
Yes.
Good afternoon, ladies and gentlemen. My great honor today to be invited for sharing information on the lesson of success toward elimination through the National Malaria Elimination Task Force in Cambodia as the whole of government approach. Referring to the National Strategy for Malaria Elimination in Cambodia 2011 to 2025, which was endorsed by the Prime Minister of Royal Government of Cambodia, Samdech Hun Sen, since 11 March 2011. And beside this strategy, then Minister of Health was committing to advise the CNM, National Malaria Control Program, in collaboration with several engagement stakeholders and partners to develop the 5-year malaria elimination action framework called MIF, M-E-A-F. MIF 1 for 2016 to 2020, and now MIF 2 for 2021 to 2025. MIF have been adapted and detailed by the strategic activity by aligning with the global and GMS strategy for malaria elimination. After MIF, the 5 main strategic activity are program coordination and management, case management, vector control, surveillance, and health education, IEC, BCC. Malaria Elimination Task Force is one of the key component strategy in program management and coordination, which is now onward in the MIF2 called enabling environment. The Malaria Elimination Task Force is likely playing a crucial role as a whole of government approach to achieve the 2025 elimination target. The objective of the Malaria Elimination Task Force are to steward the national strategy for malaria elimination, to advocate for commitment to malaria elimination to secure effective multi-sectoral engagement, to ensure effective national leadership and government and governance to provide full access for people in remote area, and to determine appropriate approach to sustain community level services beyond malaria specific services. According to the Royal Government of Cambodia Administrative Division and Health Infrastructure System, the Malaria Elimination Task Force has been structured as a delegation approach or decentralization modality to subnational level for implementation of all the strategic activity, including reviewing data, determining future steps, and planning for implementation. And as a centralization modality to the national level for policy guideline, standard operating procedure, adaptation, planning, resources, mobilization, program monitoring and evaluation, quality control and assurance, and ensuring partnership, ownership, and leadership. Up to now, the
So it seems we also have a technical problem with Cambodia, and I promise that there is no special timer after 5 minutes and then the connection breaks. This is a pure coincidence. So I was informed before there were power cut problems in Cambodia. Maybe that's one of them. So I'm sorry about the technical problems. Nothing we can do in the moment. We are going to come back to both speakers, Professor Joe and Dr. Rekol, in a short while. And I think he was already sharing quite substantially the whole of government approach to achieve malaria elimination by 2025 in Cambodia. And there should be an interesting link in the chat box anytime from now about the Cambodian task force. So then let's move to our fourth example for success. And I have the honor to introduce you to Dr. Wesley Donald. He's the national coordinator for the malaria and other vector-borne disease control program in Vanuatu. He has been with the program for the last 10 years and has held the position of national M&E and surveillance officer prior to being appointed as a national coordinator. Dr. Donald, Vanuatu recently published a case study on how innovative approaches implemented in the province of Tafea has led to the province being declared malaria-free. We would like to hear from you today on some of these approaches. Dr. Wesley, over to you. And we have to unmute you.
Yeah, thank you. Thank you. I think firstly, before I start, I would just like to take this opportunity to thank APLMA for actually inviting the country to actually present this Tafea case study as an innovative approach in reaching eliminations as part of the sub-eliminations achievement. So actually in Vanuatu, malaria is still a notifiable disease, and where the ministry and also is trying to, as much as possible, to try and work together with other government sectors, and also development partners in as much as possible to try and eliminate also malaria in other parts of the country. So as you can see on the map on the right, you can see the whole picture of the Vanuatu epidemiological malaria information. So Tafea is actually located far in the southern part of the region. And as you can see, it's that this island has been shaded as green, which means that malaria has actually been eliminated in that province in 2017, sorry. And we still have other provinces which is in the central part of the country and even north, whereby we still have a few number of transmissions going on in the country. So this is basically the epidemiological information of malaria situations in Vanuatu and the achievement of eliminations in Tafea. So as you can see all on your left, there is this case load in the annual parasites of cases in Tafia. That was from 2008 to 2018. So as you can see, there was a mass reduction in terms of the number of cases from 2008 and down to 2011, and where the provinces actually managed to record just fewer number of cases, up to 3 in 2014, and has to actually maintain this prevention of reintroductions from 2015 out to 2016, and where 2017 was the declaration of the eliminations. So that was basically the graph that actually shows the decrease of trend in the number of cases after the interventions has been conducted in the Tafia province. So actually some of the core innovative approach that the government has introduced, and also with support from other development partners, and also with the community participations and other support from other NGOs, we have actually 5 supporting elements that actually as part of the innovative approach that enables the eliminations to actually happen in the far southern part of the region, which is in Tafia province. So as you can see in the blue rectangle, it's actually the first one is the timely delivery of the proven interventions, and that's by the trained personnel to achieve the high coverage and the impact. So there has been actually the intensified elimination activities that actually happens in the Tafia province with a good implementations of these proven interventions for high coverage. So there has been some very intensified activities that actually happened that actually contributes to this massive reduction of cases in Tafia, and this includes actually the access to the long-lasting insecticide-treated bed nets, or LLINs, and we also have these other vector control intensified activities, which is the indoor residual spray, or IRS, which has also been supported by these innovative mapping tools, the geographical reconnaissance, in a way that actually is trying to make as much as possible for all the houses to be mapped and to be sprayed, so that no one is actually left behind after the operations of IRS. And the other one was actually to ensure that all the people are actually tested, either using a microscopy or RDT, in that from whichever health facilities that has been provided with these diagnostic tools, and also having the effective and timely treatment using the ACTs, which is a quarter. And also part of the timely delivery of these interventions was also this rapid reporting of malaria cases from the health facilities even up to the provincial level, and whereby it actually activates this timely response to try as much as possible to attend to the case before there is another transmission going on in the community. Now the second element that actually supports the province to achieve this elimination is actually having this established strong political commitment and effective partnerships. So what happens is that this elimination agenda in Tafia has been very much gained support with the political commitments, and also the leadership from the Vanuatu government, from the government itself. And what happens is we're actually working closely with the partners, and also even other government ministries, in trying to, as much as possible, to prioritize some of the elimination activities and to roll out some of these activities as planned. And there also has been a political support and commitment, and that is from the national office further down to the provincial office. So there was a link of communications among these authoritative offices. So just to ensure that whatever is actually happened is actually relevant and as part of the community interventions, and whereby the impacts it is actually to support those in the community. There was this
Dr. Wesley.
Sorry?
We have 1 minute left, Dr. Wesley.
Okay. We also have this other one, which is the effective national program management coupled with the strong capacity on the ground. And then we also have this other active community leadership and ownership, in which there's a strong participation from the community in trying as much as possible to make sure that the intervention is carried out successfully. The other one is having access to the aid-to-get funds and resources, which is very, very fundamental. And we have been supported by the Global Fund and even the Sri Lankan government, and also support from the technical support from the WHO. They have actually support much in trying to do as much as possible, provide trainings, provide resources and all this for the program to actually implement all this on the ground. Otherwise, there is this document which is probably on the drop-down box, which is going to be shared to the team if they wish to look into the information better. Otherwise, on behalf of the team, thank you so much for your time. Thank you.
Thank you very much, Dr. Wesley, for sharing lessons learned from Vanuatu, from the southernmost province, I think, in your country. And before we are going to have a short follow-up question for all the 4 speakers, I wanted to do a poll, but I also wanted to remind Dr. Reckel and Professor Joe that you have the chance in the follow-up question to conclude your points you couldn't before. Hopefully the connection will be then okay. So we have a small poll for you, all of you, and it's actually a question about in your area of responsibility, how has the COVID-19 pandemic affected your progress towards malaria elimination? So it might not be a question relevant for you, but if it's a question relevant for you or you don't know, then choose option 4. Otherwise, we would like to know how COVID-19 has impacted our progress towards malaria elimination. This is, of course, not a very scientific survey, but a snapshot of our audience. So the poll should be visible to all attendees at least. And we give you another 30 seconds before we have a look at the results.
Okay, in terms of the impact of the COVID-19 pandemic that actually happened. So in Vanuatu, there is this pandemic, which is COVID-19, and also followed by a tropical cyclone, category 5 cyclone Harold, that actually hit the country in April. So we actually had the 2 disasters that actually affects the country. Otherwise, it actually affects in terms of implementing the activities which has been planned by quarter, especially the mass distributions of the bed nets. And one of the effect of the cyclone is the destructions of the health facilities, whereby the program has to, as much as possible, other line ministries to try and restore back all the supplies as soon as possible. I think this is from Vanuatu. Yep.
So we are asking our audience, so maybe we show the results. I think we have only half of the people responded. Let's see the results. So we heard from Vanuatu how it has impacted. And can you share the results, Secretariat? Okay, so it looks like that 40% of our audience says more or less that COVID-19 has an impact and it will actually delay our progress to malaria elimination. And only 11% actually see that it might be even accelerated progress, maybe in brackets thanks to COVID-19. So thank you very much for participating in our little poll. And now I would like to come back to Professor Joe, and besides maybe a 1-minute conclusion of the points you couldn't unfortunately make because of our technological problems. Actually, I would like to know more or less from every speaker, but in China, the symbol for crisis and opportunity is the same, I understand. So how has China's response to the COVID-19 outbreak provided actually an opportunity to respond to future and existing health threats? And maybe 2-3 minutes, because otherwise we will run out of time. Thank you.
Thank you so much. As I mentioned before, in China, the malaria elimination program mainly focuses on the three early detection, early treatment, and early reporting. But in the COVID-19 response for this crisis, we also intensified our surveillance and response system by using 4 earlier. First earlier is early detection, early reporting, and early quarantine and early treatment. So you can understand the 4 earlier really contributed to find the cases immediately and immediate response as well. So that's why in China, the first wave was happening during the January and February, and until the end of March, everything becomes fine. Now we have only had the big challenge is imported cases through the international flights. So this we also have the close circle, all the passenger from the international flights come back to China, who will be in the quarantine 14 days. So during 14 days, some cases happen. So now we find that most of the cases is from the international flight. But probably you may understand we had a second wave happening in Beijing, and that was the last month. And in the very focalized area, which is a free market area. But because our intensive surveillance and response system, so we still have the capacity to control and finally control all those cases in the very focalized area during the 1 month. So now in Beijing, we still 0 individual cases for COVID-19. So this really help us to intensify our control program, not only for the COVID-19, also the malaria elimination program. So for the emerging infectious disease or re-emerging infectious disease, the surveillance response system is really important for the country to control or even the elimination of the disease. So this is one of the lessons we learned from China. Thank you.
Thank you, Professor Zhou. Maybe I go first to Dr. Rekol. According to the WHO, Cambodia's investments in the health security system involving whole of government and whole of society approach allowed it to successfully respond to the COVID-19 outbreak. So what parallels can be drawn between response to the pandemic and to malaria? And you might want to conclude also what you have said earlier, and then you were interrupted by our technological problem. Dr. Rekol.
So thank you. I just like to share the experience that we try to split in to make like networking in 3 different points, and we try to find the way how can be smoothly to connect of each triangle points. One from the top level, or we call the national program, or higher policy maker level, to the subnational or implementer level, and connecting with the case capturing and mobile migrant population, especially for huge amount of the mobile population returning back, immigration back into Cambodia during COVID. So this is the 3 different points that Cambodia try to understand and learn on how to make a quick connection between the implementer and the higher level of the program, or higher level policy maker, to adapt our policy and manual on how to instruct for the implementer how to be better and apply to detect case. We don't want to miss case, especially on how to bring the willingness of the returning immigration back into the country, to understand on how to protect for malaria transmission, and also on how to promote all of them to understand for the preventive measure to prevent malaria transmission. And we also want to promote between case and not case, like case subject or the implementer as the detector for malaria case, to understand on how to make an appropriate diagnosis, not only focusing straightly to only COVID. This is what that we learned during COVID, and we conduct. It seemed like the good progress, and especially we also have the common stronger for the provincial special malaria elimination task force. They, during the COVID, they also split themselves to like the sub-special task force for the cross-border province, to understand about the movement of the mobile population into the malaria high risk or malaria burden or hotspot area, for ensuring that all mobile migrant population are under tracking of our touch point, and all of them have a chance to get all the preventive measurement, including repellent or net, and also health education on how to making their well awareness on prevention and control themselves, where can they are going, if any suspect of malaria fever case, or what should they do when this geographical.
Thank you, Dr. Rekol. And I have a short question to Dr. Tang. Are you there? I don't see the webcam. So I'm not sure if Dr. Tang is there. So maybe I move first to Vanuatu one more time. So Vanuatu is one of the countries, Dr. Wesley, that is virus-free. However, the tropical cyclone Harold, which hit Vanuatu in, I think, April 2020, has caused massive destruction and malaria outbreak in some provinces. With restrictions in place to prevent COVID-19 transmission, how is Vanuatu supporting an integrated service delivery for malaria with COVID-19 response?
Yes, thank you. So in trying to, as much as possible, response to COVID-19, also TC response. So there has been a very big devastating destructions in the northern part of the country, whereby most of the health facilities and all this. And at the same time, the ministry has also trying as much as possible to conduct COVID-19 awareness knowledge. So most of these activities has been integrated together with all these activities for ensuring that the service is still maintained in these devastating areas as part of the response, and also ensuring that the messages of COVID-19 is maintained in terms of providing all these information to the affected areas. So there has been an integrated activities conducted by the public health team at the national level and also at the provincial level in assisting those at the provincial level in actually delivering the awareness to the communities in the affected areas and also to other unaffected areas. So there's been an integration among the public health programs as part of the approach.
Thank you very much. This is Vanuatu. And Dr. Tang, I think you are back. I saw you for a second.
Yeah.
Yes,
okay.
Wonderful. So my question to you, and let me quote the founding father of Vietnam, Ho Chi Minh, who has said, "Remember, the storm is a good opportunity for the pine and the cypress to show their strength and their stability." I'm sure he has said that in Vietnamese, not in English. How has Vietnam's response to the pandemic strengthened the Vietnamese health system? Over to you, Dr. Tang.
Yeah. So I don't know if I get your question correctly. So you said how Vietnam health system strengthened to deal with pandemic, right?
Yes, because of COVID-19, how has the pandemic strengthened the response of the health system in Vietnam?
Yeah, so I think the most important is we have the support, the very strong commitment from the government. Yeah, and with the limitation of the resources, so we try to integrate different vertical health system into one is CDC. So this quite flexible and fast and effective response to the disease. Yeah.
Come on, Dr. Tang. Would you like to add something?
Yeah. So I come back with malaria, and due to the first 6 months, we focus on the COVID-19. So we keep social distancing and no cross border. So malaria drop very fast and very significant. Yeah. So up to now, for first half of the year, malaria drop more than 50% compared with previous. Yeah. But now in Vietnam we stop social distancing, and we are afraid that maybe malaria will increase in the second half of the year. But we try to prepare to deal with any situation in case any epidemic or pandemic, not only malaria but also the other diseases like COVID or like diphtheria, because now in Vietnam we will have the outbreak of diphtheria in the Central Highland. But we try to mobilize and locate the resources in order to use the most effective way to deal with the pandemic. Yeah.
Thank you very much, Dr. Tang, for sharing some thoughts.
Thank you, George.
And actually, it's time for me to thank all our 4 speakers for sharing some insights. And I have the pleasure now to hand over to our chairs. And I think Dr. Satak will be first. Dr. Satak, please.
Thank you so much to our panelists. I've learned so much, and I'm really grateful. And the things that I have to share are in some ways less interesting, but they are important. So to the point around COVID, if you wouldn't mind putting up the first slide to the host. You know, I shared this slide. I wanted to share 3 quick points, and I'll focus on the last slide the most. But the first is really also in part from a personal perspective. I had the ability to be in Sierra Leone during the Ebola outbreak, and I was there in 2014 and 2015, and subsequently spent a lot of time working in that part of the world, thinking about rebuilding health systems. But in this modeling exercise, as you can see, just, you know, looking at the past, you know, in a very straightforward way, those countries struggled in terms of the malaria programs as well as HIV and TB. And this slide reflects that in terms of increases in malaria cases that track pretty closely to Ebola. And going to the next slide, this was a paper that some of you, I'm sorry, can you go to the next slide, Ritika? So turning to our current situation, this was just published online 2 or 3 days ago. And I think that, again, while these modeling exercises are by their nature quite imperfect, they do help us in terms of being thought-provoking and forcing us to think critically in areas where there may not be the right attention being elevated to the level of policymakers. And I think that in this slide, which is somewhat confusing if you haven't seen the background or understand the rest of the article, but the bottom line point of this is that what the different lines represent are basically different parts of national strategies related to mitigation measures, related to you know, full suppression in terms of lockdowns and this sort of thing, and then unmanaged or sort of less managed situations from a national perspective in terms of the response to COVID. And what it paints is a very confusing picture, which is that there are very difficult choices for policymakers in regards to this, because we don't really understand. Each of the different colored lines represents, for those that are interested, it's an interesting paper to look at, but they represent different mitigation or unmanaged or levels of suppression in terms of the kinds of government policies in place and what those what the spillover effects might be in this particular case on malaria. And these 2 different showing on one hand is a high burden area, and that would be really defined as 380,000 per 1 million, 380,000 per 1 million, and in the second case, a moderate sort of a moderate situation of around 7,000 per million. And while this data is largely again built around African models, I think we can go to the third slide. I think what it does is help us realize that we need more exercises like this for our region. And we also need, we need to be helping policymakers think through the ramifications of decisions, again, not only for malaria, but other infectious diseases. But particularly in the case of malaria specifically, I think that the preventative measures that can be undertaken, particularly in regards to, you know, distribution of nets or SMC, those things need to be sort of brought to bear full force as much as possible. And I think most people in this presentation would understand that. The last piece that I just wanted to mention this is really a synthesis of many of the points that will have already been made, but to and some of these things, some of these points were expressed in a paper that also just came out a few months ago, or a month ago, I believe. And really, that is that you know, what we are seeing is obviously leaders paying attention to health, and that's what we've seen with malaria, certainly, that there has been tremendous progress, and that we are seeing that in the examples where there is focused political will and national oversight, you can really make a difference in terms of the pandemic, and we certainly can do that we can continue to do that, and we must continue to do that when it comes to the push towards malaria elimination. And so finding ways to be able to elevate the technical aspects of the dashboard and bringing that to the leaders and using the leaders dashboard in that regard is critical. The other thing that we've seen in COVID-19 is that there has been a really, and this is to the third point here, there has been an incredibly data-rich environment in terms of digital data and providing ways and thinking about real-time tracking. And many countries in the region are already doing this in regards to malaria, but I do think that COVID-19 has offered the opportunity to raise the benchmark in terms of how we think about malaria data, how we use dashboards, and how we think about digital technologies. And obviously that goes hand in hand with the second point around malaria surveillance. And the fourth point, again, familiar to many, I'm sure, who are joining us at this time, but the legions of people, be they, you know, community health workers, or whether they're termed ASHAs or whatever the classification might be, our ability to deploy those individuals in terms of the work that they do in malaria, the work that they're potentially doing in the pandemic preparedness or the pandemic response, is something that we could continue to build on. And the last point around community engagement, and I'll come back just very quickly to the first point, which was in some ways a missed opportunity in some areas in the Ebola crisis, and hopefully that won't be the case in our region in general. Communities are engaged in a way they have not been in terms of understanding public health information. And so the degree to which we can leverage that to continue to push, particularly in the most vulnerable areas around malaria, and to build upon that would be something that will help us to accelerate our progress towards elimination as well. So I think that there certainly are hopeful messages, at least in what we're seeing in the literature and some of the early thinking that we as a region could take to bear to help us accelerate our progress. And with that, I will turn it over to my co-chair, Dr. Siti, who will share some specific examples around Indonesia and the wonderful work that they are doing in regards to this response to the pandemic and malaria. So over to you, Dr. Siti.
Thank you, Dr. Sartak, and thank you for the opportunity to sharing Indonesia experience this time. So while we are waiting for the slide, okay, the current crisis highlights the importance of having strong and responsive surveillance system. In Indonesia, malaria is a notifiable disease. We call it e-SISMA. This is a national platform. This system allows us to detect and report cases in the real time. Notifiable diseases are a key component of the international health regulation and global health security. And to ensure our continuous access to quality of testing, treatments, surveillance and prevention, and control activities during the COVID-19, we have developed a protocol on malaria prevention and control during COVID-19, and it has been circulated widely across the country. To improve case management, we have also worked to integrate reporting of cases both from public and private sectors, including efforts to ensure that the data from private hospitals are reported to the Ministry of Health. We also work with our military to ensure that cases in soldiers who are often posted in to malaria endemic area are reported to us. And this is relevant to support how we detect, test, and treat other vector-borne and infectious disease in Indonesia. It is also important to remember that every solution in the context specific, especially in Indonesia, where we have 514 districts or IUs, are responsible for implementing malaria elimination activities. Some have stronger health systems than others, allowing rapid case investigation, while others may have factors amenable to larva source reduction. In addition, districts vary greatly in malaria epidemiology, with more than half already achieving elimination, and thus focus on the surveillance for importation and outbreaks, while the other small number of districts in the eastern part of the country still struggling to bring their annual parasite incident to below than 1,000. Next slide, please. With more than 75% cases in our country, coming from the eastern part of Indonesia, a special approach taken for the 4 easternmost provinces. Active case finding by allowing village health workers to diagnose and treat patients is key to this effort. In addition, in some high endemic areas, we have supplemented active case finding through village health workers with the community-based larva source management, like we have done in the North Maluku province. In a special situation, such as for minors, tribal groups, and other migrant population in isolated or inaccessible area, we encourage use of repellents and provide outreach services for prevention and treatment service through the public sector or collaborate with NGO or faith-based organization where is needed. Infectious disease control and elimination is most possible without optimal access to the health commodities. For more than a decade, Indonesia has procured all needed anti-malaria drugs from the national budget and increasingly procure more and more RDTs and LLINs. Our procurement system is centralized that allow us to have good coordination and management of supplies. Malaria is not only the business of the Ministry of Health, but is one of the national priority and its support across all ministries. Within our decentralized system, local governments, province and districts determine their own budget allocation. But there is also opportunity for allocation of village level development funds for malaria elimination activities. Besides all the partners' commitment, province and villages will operate under an umbrella of national guidelines, thereby allowing the opportunity to coordinate funding of priority activities, one of these which is malaria elimination. And some remain challenges in Indonesia, as I think is in the rest of the region too. In terms of malaria elimination, include the burden of relapsing malaria. And for this reason, accelerating access to the radical cure for Vivax malaria is critical for this region to stay on the track for elimination. In most countries, a 14-day course of treatment is required to treat Plasmodium vivax malaria. Nevertheless, adherence is uncertain. However, our experience in much of Western Indonesia is that both Vivax malaria and Falciparum malaria can be eliminated nearly simultaneously through a good programmatic implementation. Besides the adherence, a remaining challenge is providing primaquine without G6PD tests, and the addition in some parts of the western part of the country, improved surveillance for elimination Plasmodium knowledge is needed. Without system to identify this parasite, we cannot be sure that we have eliminated human malarias. I think with this, I would like call on all of us here to urge our governments and partners to sustain and intensify our efforts towards malaria elimination. building on the progress what we have heard today, despite all the challenges posed by the COVID-19 pandemic. So with that, I would like to give it back to Dr. Shartak for the next session.
Thank you, Dr. Siti. I think the next session is to adjourn the meeting, and I am so grateful to you. I don't think that anything that I could say could do better than the way that you expressed to the group and to all of us here what we need to do. And so thanks to all of you. Thank you to our moderator. Thank you to our panelists. Thank you to our team at the Secretariats of APLMA and APMIN for joining, and I'm looking forward to continuing with all of you on this journey towards elimination. And please do stay in touch with us and let us know how we can continue to work together, in particular in regards to the dashboard. Thank you.
Thank you very much, Dr. Das. Dr. Nadia, you would like to say anything else before we officially conclude the meeting?
So thank you. I think we have various participants here. It shows us our strong commitments across our countries, across continent, I think. And in closing, I would like to take this opportunity to congratulate all the countries in the region on the significant progress made towards malaria control and elimination. And I want to express my thanks to our colleagues too for sharing valuable experience in implementation of the roadmap priorities. And I would also like to thank the audience for being engaged throughout all this virtual meeting. And I wish you a wonderful day and evening, and looking forward to virtually meeting all of you during the online Malaria Week. With this, over to you, Jos.
Terima kasih, Dr. Nadia. And just to let you know, behind the scenes, there is a discussion going on how we make available, of course, all the slides, the informational slides you have seen today, including the presentation of Dr. Nadia. Most likely, you will probably get the information via an email as you have registered. And Dr. Satak, do you want to say one more thing about Malaria Week?
Well, Malaria Week will be virtual, and I think that we will be hopeful that it will be as successful as what I think this virtual convening has been, and even more so. And so we are looking forward to seeing you all and understanding how certainly we at the Secretariat can support you all best. Thank you.
Thank you, Dr. Das. And we're gonna keep this channel open for another 15 minutes. So if you want to stay on and write things in the chat, I saw people communicating, writing very interesting comments, sharing information. Please continue to do so. Otherwise, we wish everybody a good morning, a good afternoon, and Dr. Das, a very well-deserved good night. It must be 2:30 in the morning. That's commitment. So thank you very much to all the speakers again, our Dr. Wesley, Dr. Joe, Dr. Wee, and Dr. Tang, and of course to our two excellent chairs. So thank you very much for joining, and that's all for now. But if you want to write something in the chat or any feedback on our meeting, we appreciate that. And have a good day or good night.
Bye-bye. Bye-bye.
Bye-bye.
Thank you. Bye-bye.
Thank you.
Bye-bye, Dr. Wesley.
Bye. Thank you very much.
Thank you very much,
Thank you.
Ibu.
Bye-bye.
Dr. Wee. Hong Kun. So.
Lấy với em nào.